In terms of treatment recommendations to induce ovulation, the world really now has come down to two things: clomiphene citrate or letrozole. In the past, there was a great deal of interest in doing injectable medications, for example, Minipure or Gonalav or Follistim. But the studies really don't indicate any improvement in outcomes using injectable medications. So there are indications for it, for example, if oral medications don't work. But in general today, it boils down to letrozole or clomiphene citrate. I think they're roughly equivalent. There are some studies showing minor differences between the two, depending on the indication for taking the medications, but they're essentially equivalent in terms of outcome. However, clomiphene citrate, is much more poorly tolerated than letrozole. It actually gets into the woman's brain and can cause some significant psychological symptoms. A lot of women simply don't like taking it, and in fact, it can be a reason that they don't become pregnant in the end. So we generally recommend using letrozole, and for unexplained infertility or any infertility that involves regular ovulation, we recommend that you give 5 milligrams of letrozole or 100 milligrams of Clomid, and that will generally induce 2 to 3 eggs to grow and develop. So for women who ovulate normally or have any type of infertility treatment indication other than not ovulating, we recommend that they use letrozole. And generally we start with 5 milligrams of letrozole because remember, the underlying theory behind these treatments for unexplained infertility, for example, is you want to induce 2 to 3 eggs to be released in any given cycle. And 2.5 milligrams of letrozole simply doesn't do that in many women. And you want to make sure that you make the most of each cycle. If you want to use clomiphene citrate, then we recommend that you use 100 milligrams. And 100 milligrams, once again, is usually the dose that allows 2 to 3 eggs to be created in a cycle, and that's the therapeutic dose.